Good evening, everyone. Welcome to tonight's webinar. For our opening prayer, we will have Dr. Joanne Tagorda.
Let us put ourselves in the presence of the Lord. Dear Father, we thank you for everyone gathered here now. Thank you that you know each of us by name and have caused us to walk with you. We say that we are dependent on you and our trust is in you completely. As we surrender ourselves in adoration, we welcome you amongst us today and celebrate the gift of life that you have given us. We ask that you open our ears so that we may hear your voice. Open our minds so that we may receive your eternal wisdom. Open our spirits so that we may know your leading and guidance. And open our hearts so that we may receive your wonderful love. Lord, we thank you for the speakers and facilitators. We pray that you give them great inspiration as they share with us what you have placed in their hearts. We pray that you fill them with courage and give them your peace. We ask all this in the glorious name of Jesus. Amen.
Amen.
Mga kababayan, ang pambansang awit ng Pilipinas. Kayang magiliw, sa silanganan, alam ng puso, sa dibdib mo'y buhay. Lupang binirang, mahiting, sa manluluping, di ka masisingil, sa lalatang tulog sa simoy at sa langit ng bagaw, ay hinatang tulagaw, sa pagkayang minamahal, sa katawan mo'y tagumpay na nagtitingin, ang bituin at paralang, kailan ay di magtitingin, mga araw ng waraging pagsikla, ay langit sa piling mo. Ang hinigaya na pagkay pangangin, at mamatay ng dahil sa'yo.
Good evening, everybody. I will be your moderator for this evening's event. Let us just go back to some house rules. Please put your microphone on mute. Use a headset or earphones to enjoy this learning experience. Switch off the video when not speaking. Use non-verbal means to indicate your thoughts and comments and type questions on the Q&A box below your screen. To introduce our topic for this evening, we have Dr. Mario M. Panaligan of Medicine Class 1993. He is currently the Vice President of the UERM College of Medicine Alumni Association. He is the present President of the Philippine College of Physicians, the immediate past President of the Philippine Society of Microbiology and Infectious Diseases. He's a Council of Advisors of the Philippine Hospital Infection Control Society, former Assistant Head for Training and Research, the Department of Medicine of St. Luke's Medical Center, Global City, and the former Head of the Department of Medicine of UERM MMC. Dr. Panaligan?
Yeah, thank you, Nida. And thank you to all who are participating in tonight's activity. And definitely, we are very happy that we are bringing you, of course, an important webcast conference that will tackle, of course, a very relevant issue or a very important concern, no, for all of us, particularly in our setting when we are, of course, waiting for this important measure to control the pandemic. And that is, of course, the vaccines. But we need to remember that the vaccine is just one of the different measures or means to control this pandemic. So we should not forget continuation of our adherence to the minimum health standards. Ito yung lagi namin sinasabi, no? Yung apat dapat, no? Air ventilation, physical distancing for at least a meter, always wearing the mask and face shield, no? Properly, dapat yung tama, no? And of course, the time of exposure, it should not be more than 15 minutes. No? Kung may allowance man, it should not be more than 30 minutes, no? When we get exposed or when we talk to other people or we get together. As much as possible, we should always continue our social distancing. Now, going back to the vaccines, it's not just knowing whether we actually can receive it, but we also need to know how else can we protect ourselves, no? Especially when we actually react or when we become protected, no, by this immunization, no, by this form of immunization. Kasi inisip natin, o marami nag-isip sa atin, pagka nagkabakuna ako, protektado na ako, no? Pwede na ako lumabas-labas, pero hindi pa rin eh. Kasi tandaan din natin, no, there are lots of factors that can make these vaccines ineffective, no, aside from, of course, the known efficacy, but of course, the occurrence of the different variants that are already happening. I'm sure you have heard last night, no, the news that there are 2 variants of concerns that have been isolated or documented in Cebu. And certainly, we know that this can actually start, no, in our country, as I've mentioned before. No? Kasi virus yan, eh, no? And definitely all viruses have this capability to mutate, no? And therefore can pose additional problems in terms of how we're going to protect ourselves, how these vaccines can work, and even the measures as well as the interventions that we give to our patients may no longer be useful later on. And therefore, infection control matters a lot. No? So ang bakuna, nandyan siya, pwede natin siyang abangan, at pag nandyan na nga siya, pwede natin tanggapin. No? Pero importante, dapat masigurado din natin na tayo ligtas. No? At yun din ang pag-uusapan natin mamaya. No? And we're definitely very happy and blessed. No? We have co-alumni, or co-alumni, I should say, na magagaling, no? And definitely I'm happy that we are able to get them, particularly my colleague in infectious diseases, no? Who is actually our very diligent as well as conscientious, no, faculty in the College of Medicine now. And she is also a part of NITAG, or the DOH NITAG,
Mm.
which is a very important group, no, in the in coming out, of course, with reliable interventions, particularly vaccines. And of course, we also have our co-officer, no? And certainly they will be introduced later on, no, by Dr. Fontanilla. But I'm also very happy that the past president of the Society of Allergy, Asthma, and Immunology is gonna tackle, of course, the side effects, adverse events that we need to know in terms of these vaccines that will be given to us. And therefore, I thank you all for coming or for tuning in, kasi marami tayong matututunan. Kung meron na tayong alam dati, mas malalaman pa natin kung ano yung mas tama. And I think that's the more important thing that we need to remember, that we should always rely on valuable but reliable information that are coming from the experts. And that's, of course, from our graduates of our alma mater, the UERM. Thank you very much to all. Thank you, Nida. Over.
Thank you, Mario. So for our speakers for tonight, we have our first speaker, Dr. Minette Claire Ocampo Rosario, who is from class 2001, Batang Bata. She's currently the member of the DOH National Immunization Technical Advisory Group, or NITAG. She is the chair of the Adult Immunization Committee of the Philippine Society of Microbiology and Infectious Diseases. She is currently the head of the Infection Control Committee of the UER-MMC Hospital. And our second speaker, we have Dr. Maria Carmela A. Casala. She is from class 1985. She's the past president of the Philippine Society of Allergy, Asthma, and Immunology. She's the head section of Allergy Institute of Pediatrics, the Medical City. She's the public relations spokesperson of the Philippine Pediatric Society. That's why you can see her almost weekly in TV shows and radio programs. And she's also with the communications team of the Healthcare Professionals Alliance Against COVID-19, or HPAC. She's also currently the board member of the UERM College of Medicine Alumni Association Incorporated. So we have very knowledgeable, and we have also the experts in the field of immunization and COVID-19. So to start, may we call on Dr. Minette Rosario to give us a primer on the Philippine National Deployment and Vaccination Plan for COVID-19 vaccines. Nakamute si Doktora. Sorry.
Okay, Eddie. So this topic is about the primer on the Philippine National Deployment and Vaccination Plan for COVID-19. I entitled this A Compass for the Vaccine Roadmap because this is quite a long document, and I'm going to share with you the important parts of this document. Today's discussion will be about the what, the why, the how, the when, the where, and the who. Not necessarily in this order because in the document they are integrated, but I will go through all of these in the next following slides. So what was the rationale for the National Deployment and Vaccination Plan for the COVID-19 vaccines? It's because we have a lot of cases, and the purpose of the deployment plan was to provide us with a guidance. So in this regard, while the government will lead us in the deployment of vaccines and implementation of the vaccination program, the private sector and other organizations are actually engaged to collaborate and work closely with the government to ensure a unified and coordinated vaccination campaign so that this can be conducted properly. We call this a whole of society approach. The guiding principles for the development of this vaccine plan was based on national ownership. The Philippine government has a huge and the primary responsibility of actually undertaking this plan to ensure equal access to vaccines and to implement quality vaccination services. We also have national ownership because the vaccine deployment and the vaccine activities themselves are very complex, and it is necessary, or there is a necessity, to protect national interests while ensuring that the rigorous scientific review has been undertaken prior to the deployment, and also we have considered population safety. There is also a shared responsibility where the endeavor necessitates the participation, again, of all members of society. Each member has a vital responsibility to uphold and a role to play in this program implementation. Again, the whole of society approach. There is also the principle of innovation, where the government recognizes the vitality of adapting newer knowledge and scientific evidence gathered through research and innovation, apart from the integration that happens, which is a part of the pandemic response. And the responses, or the plan, will be to integrate all of this eventually into the regular immunization services. We will not be able to get through all this without all of these task groups or all of these agencies. The plan is headed by Dr. Duque of the DOH, and then you also have the Secretary Lorenzana for the National Task Force. National Incident Command and Vaccine Cluster, you will always hear from Secretary Galvez. Down the line, you will see all of these branches. The NITAG will review and provide the actual recommendations, and all the information comes from everyone else in all of these technical groups and subcommittees. So you have the HTAC, which will evaluate all the data regarding vaccines. That's the scientific evidence. You will also see here diplomatic engagement, negotiation, finance. The adverse events following immunization committee is the NIFIC. They are the ones to whom we will report if we have or for monitoring of adverse events. DemGen and the communications. This is Health Promotion Bureau and the HPAC that was mentioned earlier with Dr. Casala. So there are a lot of people involved here. Where are we now? This is the phases of the program implementation. You will see here that we are in the preparatory period. Just so that everyone knows, DOH NITAG is here. We're meeting almost 3 times a week. And I'm hoping sometimes it's not going to be a daily meeting because it can take really long. But the deliverables are the regular updates from all the planning, from all the technical working groups. And then you have a campaign period or the implementation phase. You will see here at 21 to 28 day interval. And the whole campaign will require daily meetings. This is how it's going to go, 1 to 2 weeks post-campaign. But this is not, this is the half of the program implementation of or how it's going to work. I already mentioned about DemGen. These, the Health Promotion Bureau is actually putting out a lot of information for everyone to be informed regarding all the steps of the process or the plan. So you can go to and look for Res Bakuna Kasangganang DIDA in your social media platforms, and you will see there one of these samples is the FAQs or mga 10 bagay na dapat malaman tungkol sa COVID-19 vaccines. So in this brochure, you will see FAQs answered actually in Filipino, which is a good thing because we want everyone to understand what we are talking about. The guiding principles for the allocation and prioritization of the COVID-19 vaccines are based on 5 principles. You have the rights and civil liberties of all citizens and individuals, which will be protected and promoted. Equal respect is about all human beings being treated equally, and their interests are considered with equal moral consideration. National equity is about vaccine access being assured. especially those who have a greater burden or experiencing a greater burden of the COVID-19 pandemic. Reciprocity is about where individuals and groups who bore a great burden in the pandemic response and those with higher risks brought about by their responsibilities and roles shall be given greater priority. And then legitimacy is about the transparent processes on which decisions are based, especially if we have shared values and the scientific evidence. The same principles for allocation and prioritization of COVID-19 is also the principles for vaccine distribution and deployment. Under the or based on the WHO Strategic Advisory Group of Experts on Immunization Values Framework, the principle of public good is added, wherein it states that the vaccines will be made available to all without prejudice to practice of public health measures. The primary goals are, you have three. The primary is directly reduce morbidity and mortality and maintain the most critical essential services. The secondary goal is to control transmission and minimize disruption of social, economic, and security functions. And the tertiary goal is to resume the country's essential activities to near normal. And these are the basis for priority eligible group A. Okay? What we see here is that we want the primary goal reached. So this is the allocation of the vaccine. We have the frontline healthcare workers in A1, both national and local, private and public, health professionals and non-professionals, meaning the students, the clerks, the interns are included, nursing aides, janitors, and the barangay health workers. A2 are the senior citizens, 60 years old and above. A3 is the persons with comorbid conditions. A4, frontline personnel in essential sectors, categorized by the IATF during the essential as essential during ECQ, and A5 are those in the indigent population. So the first tranche of vaccines shall be this group, particularly A1. When we talk about secondary goals for controlling transmission and minimizing disruption of social, economic, and security functions, we have priority eligible group B, where you have the teachers, the social workers, other government workers, other essential workers, and social demographic groups at significantly higher risk other than senior citizens and indigent, and of course, the overseas Filipino workers. The tertiary goal includes resuming the country's essential activities to near normal. So for the prioritization in the context of scarcity, the objective is to reduce mortality and preserve the health system capacity. In the left part of your screen, you will see there the priority sectors, group A, B, and C being the remaining population. The deployment of the vaccines will be in a phased approach depending on the delivery, specifically the timing, the available doses, and the logistical requirements of the vaccination sites or the hospitals. It will be executed based on a sectoral approach. All frontline healthcare workers will be vaccinated first before proceeding to the next priority group. The number of individuals to be vaccinated in a round will depend on the total number of vaccines delivered, in which a computation of the second dose is already considered. So what you are hearing about the Pfizer vaccines coming in at 117,000 doses, that will be allocated already at 2 doses per healthcare worker in the hospitals that have been targeted to receive the first tranche of the vaccine supply. Since the delivery of vaccines to the country is in tranches, the deployment of vaccines in specific geographical areas shall be based on the burden of COVID-19 vaccines or COVID-19 cases. In the identification of these geographical areas, the NITAG actually set indicators which included the number of active cases and the attack rate per 100,000. So active cases refer to the total confirmed cases less those recovered and the fatalities. So for the purpose of this ranking, the computed attack rate using the total newly reported case in the recent 4 weeks divided by the region's projected population and a multiplier. In the document of this plan, you will see there that the regional, by region, the rank is NCR, region 4A, 3, I think region 8 is also there, top 4 or top 5. And again, if in the context of scarcity, we have a sub-priority grouping. So this is in consideration of exposure and mortality risk. That's why in the list of hospitals, you will see there, it will be by facility directly providing care. So it's from level 3 DOH to LGU to private. And then for the seniors, it's a highest age to lower age. And for indigents, it's in the locality with the highest burden with high risk comorbidities. This is an example of the list of eligible hospitals for the first batch of the Pfizer vaccines. Designated COVID hospitals, you have around 12, additional 2 from the area of Cebu and Davao. You have DOH hospitals, that's around 10. Government level 3 hospitals are LGUs, and private level 3 hospitals. So what do you expect? This is what, if for example, your hospital is a designated vaccination site, this is what you are expected to experience and be trained about. You have the FDA approval, everything, all the information regarding the scientific evidence is given to you. There is a simulation in your site. There is a profiling and screening. Everyone, or most of us, I guess, have undergone master listing, screening, and registration, and then vaccine allocation and distribution, and a possible simulation in your particular site in preparation for a full rollout. The implementation activities will include the actual vaccine administration and post-authorization surveillance. And in your site, this is the minimum requirement or appearance of your site. You have a waiting area, you have the registration area. The numbers that you see here are the minimum number of members of your vaccination team. And then you will have the setup, which I will show you in a while. The time here that you see below is the time that they saw will be acceptable for a vaccine candidate going through all these processes. So it will take you around 1 hour to 15 minutes, okay, for all this. What's the minimum requirement for your site? If you are a designated vaccination site, you have a waiting area, registration area, the screening, pre-vaccination counseling, and final consent form, the vaccination and the needed materials for this, and again, post-vaccination monitoring and surveillance. Across all these, you will see in the document, it's important that you have information and education communication materials, okay? Because it is not enough that you give the instruction once. In every step, you should guide the possible vaccine candidate. So your vaccination team has to have all these materials in place. The most important will actually be the registration. And then you have the pre-vaccination counseling and final consent. Again, you will see here, you should be playing a video. And this is the part where you have a final consent form signed. So this vaccination is a 2-step informed consent process. What about adverse events? So post-vaccination, I'm showing you again the expected setup where you have adverse events following immunization, surveillance, and response process flow. These can be tweaked or modified depending on the availability of the resources in your sites. And then what is important is that there is a surveillance follow-up. You will see here in the bottom right corner how frequent it will be. It's every 2 weeks for the first 2 months and monthly for 2 years. That's a 2-year follow-up. Okay. We want everyone to either self-monitor if it's a minor adverse event. If you have none, that's you're still be part of surveillance, and serious adverse events following immunization requires another process or flow chart. The example of which is this one. So you will see that the plan or the national plan was to uh, receive all information regarding adverse events because we want to study what is happening. Okay, you have a surveillance team at all steps of the process. Okay, and then you will see here that a lot is reviewed. There are a lot of information here on the bottom right corner: hospital records, laboratory results, autopsies, and the timing of all these reporting is also important. How so? This is the World Health Organization guide for establishing the surveillance. So you will see here, for minor cases, you have a weekly notification. Self-monitoring, and then they will also train you how you will instruct your vaccine, possible vaccine recipients, how to do the self-monitoring. For the serious adverse events or those with clustering, even if it's only minor, the reporting should be within 24 to 48 hours. Okay. You have particular forms to fill up, and the database is the we will get from the VIMS. Okay, that's the Vaccine Immunization Monitoring System. And then you have analysis at both national and subnational levels. So you will see here that they planned it out. There's a lot going on. The process is there. We need everyone's participation. It's important to know what to do during the entire program implementation because it will not work if only the government is the one doing everything. Okay? So the roadmap is in place. It's guided by several principles. It requires everyone's participation. The whole of society approach actually goes both ways. It's not only a trickling down that the society will receive the vaccines. The society members should actually help in the proper implementation of this program. Thank you.
Thank you, Dr. Minette. That is a very complex process. And I cannot even imagine how we will be able to roll out the vaccine program in such a big uh, coverage like the whole Philippines. So we have several questions here, but for our attendees, we will reserve your questions for later after we have our next speaker. So you just type in your questions and then later on we'll have an open forum. So our next speaker will talk about what Dr. Minette left off, adverse events or adverse effects of vaccination, particularly for COVID-19 vaccine. We have Dr. Carmela Casala.
Okay, let me just
Lambi?
put my slides.
Okay.
Okay, so can you see my slides now?
Yes. Yes, Bambi.
So good evening, everyone. And like Nida said, I'm Dr. Maria Carmela Casala. And yeah, people just call me Dr. Bambi. So no problem with you guys knowing me as Bambi lang. Okay, so tonight I've been tasked to give the position statements of the Philippine Society of Allergy, Asthma, and Immunology on COVID-19 vaccines and their adverse reactions. These statements were actually developed by the task force of PSI on the COVID-19 vaccine adverse reaction group. No? And this was headed by Dr. Maria Carmen Decena Ang. She's our young esteemed allergist from Davao City. And the rest of the task force would include some alumni from UERM, including myself from class 85, Dr. Eileen Alikpala Kohungko from class 89, Dr. Shirley Kwong Buizon from class 90, and Dr. Beatrice Boots Vicente Pascual of class 88. So there, we are all part of the task force. No? And yeah, as Mario said, this COVID-19 pandemic is really such a big problem, no, the world, no, in the past century, perhaps. No? And globally, there are about 100 million reported cases of COVID-19, with the death toll already exceeding more than 2 million. In the Philippines alone, we've gone beyond the 500,000 mark. I think this afternoon, DOH released something like 537,000 cases already. So this is really leading to a very major health and socioeconomic crisis. And that's why the scientists have been racing on to develop a vaccine. No? And there are about 200 vaccine candidates in all sorts of stages in clinical and preclinical development. And they're just really meant to stop the spread and maybe decrease the morbidity and mortality of COVID-19. So several vaccines have already been rolled out in some parts of the world, and the Philippines has its own national COVID-19 vaccination program. And Dr. Aminette just walked us through the complex but very organized program that the national government has for us. No, actually, we were supposed to start already at the very early part of this week, but due to some indemnity issues, there's just been a slight delay. But at least we know that there is some light at the end of the tunnel. So we'll just really get there. Okay, so a few months ago, we had the Quest for COVID-19 Vaccine webinar, if some of you will recall, in last July 3. And well, Dr. Anids was also our moderator. I talked on some points of vaccine immunology, and we had our guest, drug and vaccine research developer from class of 1997, Dr. Frey Chong. He's now Taiwan-based, so we had a very good discussion on the quest for COVID-19 vaccine. At that time, we actually went into discussing basics of vaccine immunology, from innate to adaptive immunity, which are very important for the immune response and very important in the sector of vaccine development. And the WHO recommended a pandemic vaccine target product profile early on. And now we see 6 months from that time, the vaccines are already here. And most of the vaccines that we are discussing now are just basing our mRNAs, and they're basing their virulent factor on the spike protein. So much of the work is actually centered on that. Okay, so this position paper was developed in response to the concerns of many healthcare workers and the lay regarding adverse reactions to COVID-19 vaccines, especially allergic reactions. So very simple. We had 3 statements in the position paper. And statement 1 is actually about the reactions. No? So adverse reactions to vaccines may occur and can range from reactogenic reactions to allergic reactions. Majority of the reactions are reactogenic, or an inflammatory response that occurs after vaccination. They are not exactly the same as allergic reactions. No? And these reactogenic reactions may actually be just local or systemic reactions. For the local reactions, we may have some pain, swelling, tenderness at the injection site. But usually this just occurs during the first 3 days and resolves by itself. Because of leakage of mediators, then sometimes we see some systemic reactions such as headache, fever, muscle pain, body aches, tiredness. But these reactions are all mild to moderate and usually gone within 1 to 3 days. Allergic reactions, on the other hand, are actually exaggerated immune response to a usually harmless substance. But there are different types that involve different mechanisms and symptoms. But suffice it to say that mild allergic reactions would manifest as rashes, itchy skin, runny nose, sneezing. And the very severe allergic reactions, or what we call anaphylaxis, are really very rare. Now, what is this anaphylaxis that we talk about? It is having a very severe allergic reaction wherein you would have two or more of the following symptoms. No? You would have some skin problems like hives or flushed skin itching, with combined with some swelling, with difficulty of breathing, sometimes abdominal cramps, and even hypotension. Now, usually this happens within the first 30 minutes after injection, but may happen after about 1 to 4 hours. But to date, no reported confirmed cases of death from anaphylaxis to COVID-19 vaccines. Now, statement two would involve management of these reactions. Now, reactogenic reactions are managed with supportive care. No? So I mentioned earlier, reactogenic reactions are those that happen locally or systemically. So they have pain, you have itching, you have some fever, sometimes some headache or some body malaise. So these are just given supportive care. Paracetamol or pain relievers, that ought to do the trick. Compresses too at the local injection site. For mild allergic reactions such as the itchiness, the rashes, you may have sneezing or itchy eyes or coughing. No, so these can be treated with anti-allergy medications or antihistamines. Anaphylaxis, a very severe kind of allergic reaction, these are actually very rare, but of course they must always be at the back of our minds that it might happen. No, so they should actually be recognized immediately and managed promptly. And the drug of choice, of course, is epinephrine. So it's very important that every patient should be observed for at least 30 minutes post-vaccination. And in Dr. Minette's slides, you see there a post-vaccination observation area wherein they should stay and be observed for any adverse reaction, whether mild reactogenic or mild allergic or even a severe allergic form of reaction. No? Okay. So this is very hot off the press. This is an infographics that was developed by the Philippine Society of Allergy, Asthma, and Immunology, showing the side effects of COVID-19 vaccination. This was what I alluded to earlier. The common local ones: pain, redness, and swelling. Common systemic ones: headache, fatigue, fever. And then the less common allergic ones: hives, coughing, sneezing, itchy eyes, red eyes, and the very rare allergic reaction, anaphylaxis, which would have two or more of the following: hives, vomiting, tummy aches, coughing, sneezing, with difficulty of breathing or a drop in blood pressure. And also it includes a statement as to how it is managed: supportive care only for the common local ones, and anti-allergy for the allergic reactions, and epinephrine for the rare anaphylaxis cases. So this is very concise in one poster. You can see already everything that is in the two statements of the position paper of the Philippine Society of Allergy, Asthma, and Immunology. So yeah, that's very new. Only finalized last yesterday, but has been shared so many times already, including in our website. If you want to see this further, this is in our website, psaai.org. This is, I repeat that, psaai.org, our website, so you can see these infographic posters. And I'm very happy to announce also that it was also included in the recently in the Apache website, the Asia Pacific Association of Allergy, Asthma, and Immunology, courtesy through our friend, the President, Ruby Pawangkar. So that is already gaining popular viewing already. Okay, so the last statement that we have for our position statements of the PSI: the only current contraindication to COVID-19 vaccination is an allergy to a previous dose of COVID-19 vaccine and any of its components. Okay, so yun lang po. So if you've been hearing that you've had allergies, you're not allowed to take the vaccine, that is not true. Only those with immediate allergic reaction, mild to severe, such as anaphylaxis, to the first dose of the COVID-19 vaccine. No? You all know that there's a 2 dose for the COVID-19 Pfizer mRNA vaccine. No? So if you've had a reaction, whether it was mild or severe, to the first one, then you will not be given the second dose of the COVID-19 vaccine anymore. Also, if you've had a history of allergic reaction to any component of the COVID-19 vaccine, particularly the culprit seems to be polyethylene glycol or PEG or polysorbate. So if you've had any questionable allergies to vaccines or any industrial product or what, then perhaps you ought to be seen by your allergist and immunologist for further evaluation prior to having your vaccine. Okay, so those are that one. But who can receive the COVID-19 vaccine? So, Nida, this is for you. Patients with allergy to food such as egg or allergy to inhalant allergens, sabi ko na mag-react eh. Allergy to insect venom, those with eczema, allergic asthma, allergic rhinitis, even those on medication, regular medications, you can still receive the COVID-19 vaccine, even if you have hives or urticaria or history of rashes to oral medicines. Now, those patients with depressed immune system or autoimmune diseases, they can still receive the COVID-19 vaccine, but since the information is still lacking if the immune response to the vaccine may be reduced, no? So they have to be informed that they are not yet, this is still in progress. No? The studies are still in progress, so we still don't know exactly the immune response to the vaccine in these cases. No? So, okay. So again, I'm sharing another hot off the press infographic posters from the PSI. This is who can get the COVID-19 vaccine. And what I just went through for the statement 3 is all embodied in this poster. Who can get the vaccine, who should not get the COVID-19 vaccine, who should be evaluated before the vaccination. And of course, there's a warning here. Patients should be observed for at least 30 minutes after the vaccination. Okay? For proper monitoring, diba? Okay. And so, in summary, while the COVID-19 remains a big global challenge, the vaccines are here. Although the vaccines are not going to be the only solution to our pandemic, as Dr. Mario earlier mentioned, it may be part of the solution. But we are still part of that's a big part of the solution as far as preventive care is concerned. We still need to continue our preventive measures. And regarding the vaccines, reactions to COVID-19 vaccines may happen, okay? But majority are local and systemic side effects only, and they usually will disappear within 1 to 3 days, okay? This is not just in literature. This is what I've also been receiving from my colleagues, my doctor colleagues in the abroad who have received their vaccinations. That is what they're saying. It's just very temporary, okay? And if ever there will be allergic reactions, they will be very mild and easily managed with antihistamines. The severe form of allergic reaction is very, very rare and is managed with epinephrine. So patients with allergy to food, inhalant allergens, insects, and those with stable bronchial asthma, allergic rhinitis can receive COVID-19 vaccine. As for patients who should not be vaccinated, those who had an allergic reaction to the first dose of the COVID-19 vaccine or the components such as polyethylene glycolate or polysorbate, which cross-react with each other. And patients who have had an allergic reaction to other vaccines or injectable medicines should be referred to an allergist for further evaluation. Patients should be monitored at least 30 minutes after vaccination. We keep repeating this because it's a very important step as far as surveillance and monitoring is concerned. And based on current data, the benefits of receiving the COVID-19 vaccine far outweigh the risk of an allergic reaction. For the Pfizer mRNA vaccine, the risk of anaphylaxis is just 5 in 1 million doses, and no reported cases of death confirmed, secondary to anaphylaxis due to the COVID-19 vaccine. It is actually 100 times more likely to die from COVID-19 than to have a serious allergic reaction to the vaccine. So therefore, We hope that actually this position statement makes you aware of the allergic and the reactogenic reactions from the COVID-19 vaccines. I hope that this would actually help the medical community communicate to their patients, to their loved ones, to their family and friends about the vaccines and the side effects of COVID-19. And as a parting word, I'd probably leave you with this last infographics that we made. It is in the vernacular Tagalog. Kabado ka ba? Anong dapat mong malaman? There are 7 points here, and if I may share right now, so ang COVID-19 ay maaaring magdulot ng malubhang sakit at makamatay. Ang pagbabakuna laban dito ay magbibigay ng proteksyon at maaring maging bahagi ng solusyon sa pandemyang ito. Hindi lahat ng reaksyon sa bakuna ay dahil sa allergy. Huwag ho kayo matakot doon. Karamihan sa mga reaksyon ito ay banayad lamang. And ang panganib ng anaphylaxis o malubhang allergic reaction ay napakadalang sa nababakunahan. So wag rin ho kayo matakot doon. Ang mga taong may asthma, allergic rhinitis, allergy sa pagkain, Dr. Fontanilla, latex, oral drug, insect, mga walang kaugnayan sa vaccine ay maaaring mabakunahan. At sa ngayon, ipinagbabawal ang pagbabakuna sa COVID-19 sa isang individual na nagkaroon ng allergic reaction sa naunang tinurok na COVID-19 vaccine o sa anumang sangkap nito. And kahuli-hulihang parting word, mas nakakahigit ang benepisyo ng mabigyan ng proteksyon sa pamamagitan ng bakuna kaysa sa panganib na maaaring idulot nito. So there you have it, mga dapat nyong malaman para hindi ho kabahin at kailangan po nating masabi, no, o spread natin ito para matulungan po ang ating mga kababayan na hindi matakot para ma-receive po ang bakuna. You know, a good vaccine is useless if nobody goes for vaccination. So, dapat ho, walang kaba, magpabakuna. So, thank you very much for your time and attention. And if you have any questions, we'd be more than willing to answer them in my capacity. Thank you so much. Nida, back to you.
Thank you, Dr. Bambi. Bakit lagi mo akong pinatatamaan, pinariringgan?
Kasi takot na takot ka.
Oo, yan ang katawag mong kapraningan. Okay. So
I'm sure hindi lang ikaw, doktor pa, no? Mapapaning ka. I'm sure may mga sa publiko na talagang hirap din silang magdesisyon tungkol sa bakuna. So I hope that this position paper and this discussion of the national program given by Minette will actually help allay fears and anxieties of the public.
Okay, we have here several questions. I think I can read them out for the benefit of those who are shy to ask questions. But Dr. Minette answered some of them already in writing, but okay lang ba?
I answered na all of them.
You answered
except
all
for
of
the
them?
one for Dr. Akasala.
Okay. Anyway.
Ay, ang daya. Kailangan sabihin din yan.
Okay. But I listed them down. Huwag ka mag-alala. I listed them down. So for the benefit of those who perhaps would be asking the same question but are just too shy to ask. Okay. From Victoria Dumlao, she has 2 questions. Paano mga kasambahay? Saan group sila? I think that's for Dr. Minette. And she has another question. How about kidney transplant, status post kidney transplant, angioplasty, open heart surgery, and with history of cancer in remission? What category do they belong to? So Dr. Minette, for the first question, paano mga kasambahay? Saan grupo sila?
In the document, they are included in Group B.
Group B.
All the remaining workforce, yeah.
Okay.
And then for the question about the, is the question about the timing of receiving the vaccine? Tama po ba?
I think for the kidney transplant angioplasty, are they candidates? Are they eligible to get the vaccine?
Yes, actually, because they have comorbid conditions. And then the only absolute contraindication would be the history of severe allergic reaction to the PEG or the polyethylene glycol that Dr. Casala mentioned. However, in a statement that PSMID released recently about the immunocompromised host, particularly the kidney transplant recipient, including the post-transplant and those with a history of cancer in remission. They have to discuss this with their physician. We are actually requesting a clearance from their attending physicians regarding their condition because the vaccine efficacy and safety has to be discussed with these patients so that they will understand and then they can have a shared decision making with the patients. Okay. Yun po.
Okay.
If I may add on that,
Yes, please, Dr. Bambi.
yeah, well, the status kasi of these people are, syempre, they're immunocompromised na. But as you know, all our vaccines right now are on emergency use authorization only and have not even gone through the phase 4 clinical trials, which are actually required as far as vaccines are concerned for as far as if they get the CPR or the certificate of product registration and be able to be sold. No, so these are being given because of an emergency, the pandemic. Now, so the studies are not yet all in, especially for that kind of category, yung immunocompromised, because of course, there may not be many cases yet to get the status kung how their immune status would be if they are still going to react properly to the vaccine or not. No? So that's why yes, a shared decision. They should be informed that the studies have not yet shown efficacy for such cases, but they must be informed. They can receive it if they wanted to, but yun na nga, limited yung information as to will it be effective for them.
Okay. Thank you, Dr. Bambi. Bakit parang lahat kasama ako sa ganong category? Anyway.
Pero yung kaninang tanong din, yung kasambahay, depende rin kung may edad na, di ba, Minette? Kung may edad
Yes,
na.
if they fall kunwari into the senior citizen, maiiba yung category din kasi nila. Or they have comorbids, yes.
So pwede yun. So when they get listed, di ba, Minette, sa mga LGU, they actually have to ask illnesses. No?
Right.
Yung, kasi medyo natatakot dun sa pag-register kasi natatakot sila baka yan na sila kagad nung vaccine.
Or they are worried na hindi na makaka-back out parang ganyan. But they can.
Yun na nga, I think communications really have to be improved as to allay the fears of these people in the LGUs. No?
I think the LGUs now are rolling out their program, registering their residents, no? Particularly here in Quezon City, they have ID system for the residents. Whether you are a resident or you're just a transient, meaning you're just employed in Quezon City, but you can actually avail of some of the services of Quezon City. So, kasi nga naman, kung nagka-COVID ka sa area of employment mo, di ba? So, hindi ka naman not necessarily sasagutin ng employer, but you can still avail of the services provided by your LGU, particularly Quezon City. Okay, Dr. Minette, ha?
When it comes to yung sa that the employer will take care of you, there are kaya na may indemnity law. Being pushed and being rushed actually. Cover all that in PhilHealth. So yeah, even if they do get problems post vaccination, that will be covered by that.
Yes. Okay, another question from Dr. Mila Rabe. What category will PWDs belong to? I guess you answered this already, Dr. Minette, but for the sake of those who may have the same question.
Still group in the document, it's Group B, but just like the earlier question, if they have the comorbidities that will be listed there, or by age, pasok sila sa senior citizen. Pwede po silang ganun.
Okay.
Pasok sa lahat. Paano ba yan?
Yun. Another question. Tama, pwede ba to tanungin? Is this vaccine program dependent on the passing of the indemnification law?
That's a lot.
In the discussion po kasi, the difficulty was getting out the informed consent, a proper informed consent form. So I answered in the Q&A box that partly yes, because we cannot, what we want is a unified informed consent. So we cannot put that out if we don't also put in what the pharmaceutical companies want stated in that informed consent. So currently that has been arranged and is now in the DOJ for actual approval. So those are the smaller details or the steps that have to be addressed. But otherwise, like Dr. Casala mentioned, we're also trying to arrange it in such a way that when the vaccine recipient develops a serious adverse event, there will be a medical assistance that will happen.
Okay. Thank you, Dr. Minette. Question from Richard Elwin Fernando. How do you assure that they will receive the same brand of vaccine for the primary and the boost dose?
It has already been computed. It will be computed per tranche that comes in. So kunwari nga, sinabing 117,000 ang doses, kinompute na yon dun sa 55,000. 55,000 for, you will see, if you remember the list, yun na po dapat. Makompleto po 2 doses per individual or employee in those hospitals.
Okay. So nakabilang na yon. Kaya
yes,
do not double register, no?
Yung yes, that's why it's important also.
Okay. So if you registered in your place of employment, wag na dun sa LGU, siguro ganyan.
And actually, the recommendation is you have to choose Kunwari,
okay.
If ako, I'm affiliated with 3 hospitals, I have to choose in which hospital I want to receive the vaccine.
Yeah.
Monitoring din naman yan, needs Hindi pwedeng. Sa scarcity ng bakuna, hindi maaaring madoble yung mga yan.
Oh, okay. Another question. I think this is for Dr. Bambi. If allergic to one type of vaccine, can he try another type of vaccine?
Oh, try din siya. So, well, in the first place, right now, dadalawa lang ang naka-EUA. Diba? So, yung isang Pfizer, tsaka yung AstraZeneca. So, at tsaka yung isa, matagal-tagal pa bago dumating. No? So, ang choice mo, isa lang. So, yung right now, it's just the Pfizer mRNA. And people are scared because dyan marami yung na-report na allergies. No? But, yun nga, they looked at the causality. It's not, most of them were not really because of allergies. So, chances are, maliit lang yung chance na magkaroon siya talaga ng allergy and even the anaphylaxis. So, if yun ang pinoproblema niya, wag na niyang i-pass up yung chance na magkaroon siya ng allergy. Pero, kung nagkaroon siya ng mild form of allergy, talagang hindi na siya pwede dun sa bakunang yon. Perhaps later on, if medyo iba yung mechanism, baka pwede siya dun sa
Sinovac?
Or whole virus. So, it's hard to say kung anong dumating sa atin. No? So, kung anong bakuna ang sumunod.
Okay. Another question. I think this is for Dr. Minette. How about dentists? What group would they fall under? Dentist, pharmacist?
Healthcare worker.
Healthcare worker. Okay. Healthcare worker.
But it's important kasi there's parang a clarifier or a specifier where you have to be, uunahin ka kasi nga in the issue of scarcity, unahin ka if you're part of the COVID health facility and something like that. Okay. Directly seeing COVID patients.
Kung virtual ka lang naman pa.
Oo. Yeah.
Frontliner muna.
Oo. They would want to get the infographics daw presented. Is there a way that they can get a copy? We will be
It's in the website now. If you want to,
uh,
right now, as we speak, you can actually get it in there.
the website of Philippine Society of Allergy, Asthma, and Immunology. How about the
aai.org.
I think yung lecture ni Dr. Minette, there's the complete document is in the DOH website, right?
Yes,
Oo.
yes. And yeah. And
Oo.
if you took a screenshot, the link is there.
Oo.
I mean,
Oo.
the statement then, the position statement on adverse
Right.
reaction, it's also on the website.
Okay. Yes, another question from Dr. Enrico Conrado Rossi. Good evening, doctors. Due to the lack of manpower, can we allow other allied healthcare workers as vaccine inoculators, such as dentists or pharmacists? Thank you.
In the document, they didn't specify who
Oh,
or what work or profession should be there, as long as they have the skill and they actually have to undergo
a
training.
training, yes. They
Yeah.
have to be certified, diba?
Yeah.
I think there's a
Yeah,
certification also.
it's important because you're dealing with, especially if your site is receiving the Pfizer or the Moderna vaccines, there's a particular way to prepare the vaccine. It's very sensitive to light and to the reconstitution and dilution method. So it requires training. There's actually a WHO open source
Yes, I saw
training.
that. Yeah, I saw that.
So if you want to go and start training on your own by at least for knowledge, we actually recommend the WHO open source website for that.
Okay. Thank you, Dr. Aminette. Ah, nasagot na ba natin to? Sorry. Is there any significant difference in the side effect of the different vaccine brands or types?
Which one? What's that again? I'm sorry.
Sorry. Is there any significant difference in the side effects of the different vaccine or brands or types of vaccine?
Like I said, hindi pa tapos lahat ng studies, no? So far what we have are actually the local reactogenic reactions, which are actually just the usual reactions that we get from other vaccines, di ba?
Okay. Yeah.
Well, I'm a pediatrician, so I've seen those with the DPT. No, they really, these children really cry out because of pain and local tenderness, and we do give paracetamol. So same thing, ganun din lang. At konting bigat, konting ano, and if ever they feel that, it's actually, it actually shows that the vaccine is working. No? Nagkakaroon ng mga cytokines dyan sa area mo. Nagkakaroon ng inflammatory response, which is why you feel hot, you feel weak, you feel and all that. No? So basically, right now, yun ang mga lumalabas na mga reactions na rinireport. And for Moderna, I think it has a less statistics for anaphylaxis, about 2.8 per million doses, while Pfizer mRNA has about 5 per million doses given. So the rest, wala pang mga reports. But yon, in the recent international study of vaccines, they reported that there have been no confirmed reported deaths secondary to anaphylaxis due to the COVID-19 vaccine. So yun ang importanteng matandaan din para hindi matakot ang mga tao about that. Kasi masyado na play up eh. No? And then ang dami nagtatanong about that, but it's so rare. So they shouldn't worry about it.
Okay. Another question from an anonymous attendee. Bakit ayaw niya magpakilala? Anyway, I have a prior history of reactions to flu vaccine where I developed generalized maculopapular rashes and pruritus. What would you recommend, Dr. Casala, in such cases? Naka-direct na sa yung question, Dr. Bambi.
Well, kung gano'n, may allergic reaction to a vaccine. Kailangan ma-evaluate siya ng allergist kung bakit siya nagkaroon ng allergy. No? Hindi naman necessarily dahil dun sa bakuna mismo. Sometimes you have to establish the causality and the incidentality, diba? Baka nagkataon lang na nagkaroon siya ng ganung problema. But these things have to be established, and then kailangan ma-investigate kung what in particular did he react to in the flu vaccine? Baka the components lang, the adjuvants. So if there is a common adjuvant or that he reacted to that is also in the COVID-19 vaccine, then yeah, it's not good that he would receive that vaccine. Pero if it's established na he has nothing to do with that, then yes, he can still receive the COVID-19 vaccine.
Okay. Another question. Okay, question ko to, Dr. Minette. When will we start the rollout from Danilo Alcantara? Kasi di ba mention ni Dr. Bambi kanina, nakaschedule dapat February 15. Di ba, Dr. Bambi?
Yeah. And some people say meron ng simulation burnout, but that's okay. But everyone should be prepared by then. I cannot say the particular date. That will depend on everything that's happening, as I mentioned, regarding the consent, the procurement, the discussion, or the agreements with the COVAX facility.
Okay.
Malalaman na rin eventually yan. But
this first quarter of 2020.
yes, yun yung expected kasi, mami. But everyone said na, di ba, end of February, it's going to be done for the assigned DOH hospitals, pero none yet so far. So
okay, we will wait.
I hope it happens.
Sana soon.
It happens. I cannot say kung soon, but I definitely hope it happens.
In the meantime, kasi Bids and Minette, ang maganda dito, if there is time for us to talk to other people, those who are hesitant.
To advocate.
And those who are really anti-vaxxers, diba? So there's time for us to convince them, or maybe not to convince them, but just to talk to them and try to see if they will change their minds and ask to be vaccinated. Kasi the more people who get vaccinated, the better for all of us. It's not just about us lang as an individual, but for the nation as a whole. So kung mas maraming mabakunahan at an earlier possible time, then the R0 will actually go lower, and then we won't have to vaccinate everyone in the end. Diba?
Mm-hmm.
So sana nga makonbinsi pa natin, and let's take this time na delay. Meron sigurong rason kung bakit na delay. Diba?
Agree.
Diba? So, gamitin natin yung oras na yon para makumbinsi natin yung iba.
Yes, I always believe that there's always a reason behind all the delays. It's not really a setback, but in the right time, sabi nga.
Yes.
Okay.
Let us just it's a lesson in patience nga naman daw.
Okay, another question from another anonymous attendee. Good evening, ma'am.
Anonymous?
Oo eh. Ang dami may pangalang anonymous. What category would physician moonlighters who are not employed in or affiliated to any hospital fall under? Yung mga nagmo-moonlight?
Not in any hospital?
More likely clinic.
More likely clinic?
Or hindi sila considered employee of any hospital or not regular clinicians in a hospital, mga moonlighters.
They still fall under healthcare workers.
So they should register.
So may subcategory, yeah.
So they should register with the hospital that they are moonlighting in.
Yes.
The one that they frequent most.
Yeah.
I guess. Okay. From another anonymous attendee. If you opted not to get vaccinated during the duration of the program, will you still have the opportunity of getting vaccinated after? Will it become available in the market?
Okay. So it was one of the issues, the first issues that came out was if, for example, as a healthcare worker, you decided not to receive the vaccine, ang mangyayari kasi would be tatapusin na lahat. You're in line, supposedly as a healthcare worker, but you decided not to get the vaccine. So you go out of the line, nandun ka na sa dulo. They'll finish everyone else, general population. So priority group C, and then ikaw na.
Ulit. So if you're already in line, do not get out of line. Diba? Nakapila ka na, dun ka na.
Pwede yung lateral entry.
Yeah.
Oh, wala
Bawal
yung
sumingit,
singit-singit. Oh, bawal singit-singit.
Tapos dumating yung bagong supply, sama ako uli. Hindi pwede.
Oh, pila ka. Pila ka. Kung anong available dyan, yun ang sa'yo. Diba?
Kaya nga we're advocating for be in line. Because when you're in line, you're already assured that you'll get the vaccine.
Right.
Regardless of what vaccine it is. Because all vaccines have good efficacy naman po.
Okay.
And mind you, wala akong bayaran to, Wala ko naririnig kasi yung mga inaalok na lahat through the national government. And,
walang fixer dito, walang fixer.
Okay. Kahit yung mga LGU na nagpapalista sa inyo, it's just for listing. There's no reservation fee involved.
Okay.
If you hear something like that, magduda ho kayo. Hindi ho
Yeah, correct.
Oh, tama.
Because it's supposed to be a free service.
This is part of the national deployment program. So, hindi ho dapat bayaran yan. Binibigay ho yan ng gobyerno. Serbisyo ho natin yan. Atin yan. Kaya nga ho, i-consider natin yung bakuna na atin. Kailangan ho natin paglaban yung ating karapatan na magkaroon ng bakuna, and pag nandyan na po yung bakuna, magpabakuna na ho tayo. Yung iba ho kasi pag sabi, ayoko niyan kasi 50% lang ho. The WHO, like I said, ang target product profile nila, they actually accept the 50% at least efficacious and effectivity, no? So it's better than not being protected at all, diba? Ground zero right now, all of us, zero, no protection. But once we get vaccinated, at least, even if you get those that are just 70% or hindi yung 90%, at least meron ka pa ring chance na ma-protect kita.
Okay. From another question from Francis Villar. Good evening, Dr. Minette.
Batchmate ko yata yan.
Okay. Classmate. Okay. This is Dr. Francis Villar. Classmate nga, Medicine 2001. Tropical Medicine Fellow in training at San Lazaro Hospital. If the patient had recently received rabies immunoglobulin, which has a half-life of 4 months, can we still give Pfizer COVID-19 vaccine? Rabies immunoglobulin can affect or diminish efficacy of other vaccines like BCG, influenza, measles, mumps, and poliovirus vaccine.
There is no other contraindication to receive the mRNA vaccine except for the allergy, severe allergic reaction.
I guess that would also answer.
Yun lang ang tatandaan po nila.
Isa lang, wala na ka nang memorize na iba, yun lang. Okay. Yeah. Similar to the question of Micaela Ramos, si Miki ba to? What would be the recommended time interval between administration of COVID-19 vaccine and another vaccine, example, flu vaccine? Kasi April na yung flu vaccine. Time interval
CDC is saying 2 weeks interval between the COVID vaccine and any other vaccine.
Okay.
Non-COVID vaccine, I mean.
Okay. Another question. Bakit ang mahilig mag-question si Anonymous? When will efficacy studies for post-kidney transplant patients who are immunocompromised with comorbidities come out po? Meron ba? Kasama ba yun?
In the recent phase 3 trials, very small, actually no population for the transplant patients, but I think they're going to start studying those with comorbidities.
Yes, okay.
So you really say when?
Ma'am Jopay de Luna, okay. Will you upload this webinar? I think this will be in Facebook, no? Facebook, so Facebook of the Alumni Association. So I think you can view, okay?
And also YouTube.
Oo nga pala, YouTuber na tayo. Like.
YouTube na alumni, yeah.
YouTube. May YouTuber na pala kami, ang Alumni Association. Okay. So, si Anonymous attendee na naman. Good evening, doctors. Aba, binola pa ako. Dr. Fontanilla, who still looks young and beautiful. Sino ka? Despite the current evidence on efficacy and safety of the vaccines, a lot of patients are still hesitant to get vaccinated. What is a good strategy to convince them to get shots, especially the vulnerable patients, Dr. Casala?
Lead by example. Be a vaccine advocate. So, hindi lang pwedeng quiet lang tayo ngayon. If you are a vaccine advocate, go and push. And then when the vaccines come, magpa-vaccinate and show the world that you're having the vaccination.
You should have a video of your vaccination, your shot, dapat, and then post it in your FB, and then
that can go viral, diba?
Viral, yes, viral.
There's an actual study, Doctora, regarding vaccine hesitancy and the effect of the healthcare worker on patients' decision regarding that. So they saw that in a particular study, they saw that the vaccine hesitant healthcare worker affects the decision of the patient. Because in the first place, they are afraid to mention the word vaccine in consultations. It's not brought up usually. So actually, if you advocate for it, it will be better for everyone. It has to be discussed.
Well, I'm a pediatrician, so of course I'm a vaccine advocate. So yes, and I understand. I know that there are some who are vaccine hesitant among our own medical community. So I hope that with time and all these webinars, I think we can actually do a paradigm shift and convince them that they actually kailangan manggaling talaga sa mga doktor eh. Kasi ang laking bagay, di ba? Minette, yung mga pasyente, ang laking tiwala talaga sa doktor. Kung nakikita na ang doktor mismo ayaw magpabakuna.
Right.
Talagang mahihirapan tayo to convince. So I think a number of us doctors it's our duty and that we should actually push for vaccination and get everyone convinced that this vaccination is safe. My whole family is going to be vaccinated. I'm saying it now.
The PCP has started rolling out ads on Facebook, Instagram, Twitter. So PCP, isa-isa kami, nilabasan namin yung mga ads that we of course believe that this is safe and effective. So I think we should always encourage everybody that this can be very, very useful for all of us.
There's still time.
Yes.
Okay. Dr. Bambi, if in the future there will be COVID vaccine for pedia patients, how will we address psychological barriers for willingness of the parents to have their children vaccinated?
Right now, cannot be less than 16, no?
Oo nga eh, no? Paano yun?
I think there are ongoing studies now for children abroad. But, syempre, everything nga is an EUA. So, mahirap pa mag-advocate for children. And because medyo mild naman ang COVID-19, sometimes they're asymptomatic pa. So, hindi masyadong priority right now yung vaccination ng children. If we actually end up vaccinating a whole lot of our adult population, they'd probably be just as protected already. So it's hard to say because there's no vaccine yet and there's no studies yet that are out for pediatric preparation.
So we will again wait and see.
It's been like that, no? I think already. See. Like I said, it's a lesson in patience, and we really ought to wait. And then, ang mindset talaga dapat natin. The vaccine is going to be coming na, so we better be prepared for it. John the Baptist yan, prepare the way for the Lord. So this one, we prepare the way for vaccination. But we mustn't also get their hopes too high na as soon as ma-vaccinate, mawawala na kagad ang COVID-19. Hindi tama rin yung ganun ng kukote. No? So we still, like Mario mentioned earlier, apat dapat, air circulation, physical distancing, always wear mask and face shield, and the time of exposure. These preventive measures are there to actually continue helping us in controlling the spread of COVID-19. Of course, after frequent hand washing talaga din. Yeah.
Okay. Another question. Ma'am Divina Gracia. I'm a senior citizen. Kaba. I have to submit myself for vaccination. In your presentation, there was no mention on GBS, Guillain-Barré.
Oh, that's allowed, ma'am.
Ma'am, I'll answer.
Okay.
The FDA document by Pfizer mentioned the incidence or the occurrence of GBS in some of the recipients, but they did not find an actual causality. And then they are saying that the occurrence of the GBS will just be as likely in the general population. So you can still receive the
For that matter, they also mentioned, I think, in that document, yung sa Bell's palsy, diba? And other autoimmune diseases.
Yes.
Yeah. Talaga nga, ang contraindication lang talaga, yung nagkaroon ng mild or anaphylaxis to COVID-19 vaccine. So yun lang talaga ang contraindication.
Ma'am, magpalista na kayo, ma'am. Okay. Yun, again, I am asthmatic. Another question from Bernadette. I am asthmatic and hypertensive with atherosclerosis, but annually have flu vaccine. Is it safe for me to be vaccinated? If yes, what particular vaccine would be best suited for me? I'm 63 years old. Thank you.
The best would actually be the one that's available at the moment that you are called.
Sabi nga po, pumila na kayo. Kung ano yung, kung nasaan kayo sa pila, kung ano yung dumating sa inyo, yun na yun.
Don't be afraid of the vaccines that are with the vaccine portfolio right now. They have been vetted by so many of the country's top scientists, from the vaccine expert panel to the health technical assessment group to the council to the National Immunization Advisory Technical Group, for which Minette is part of, and then the VEP and the HTAC, we all have PSI members also part of those, and also, of course, a lot of our members also are part of the National Adverse Event Following Immunization Council, NAFEC. Dami kasing acronyms. But yeah, before a vaccine can actually go out and apply for EUA and have its EUA approved by the FDA, nako, it has passed through so many evaluations and reviews and all that. Na-vet na po yan. Hindi na po kayo kailangan mismo ang magbasa about the vaccine kasi binasa na ho ng husto at bago pa ho marekomenda na nadaanan na po lahat yan ng evaluation. So for it to be part of the vaccine portfolio of the government, then it must be good. So anything that is in that vaccine portfolio of the government's vaccine portfolio for their plan, pag nag-roll out ho, nakapila dapat ho yung pangalan ninyo. Kuhanin nyo na po yung bakuna. Walang kaba, magpabakuna.
Oh, yes. Okay. We have one last question. I think this is for Dr. Casala. While we are waiting for the results, this is from Richard Alwin Fernando. While we are waiting for results, what are your speculations why the vaccine will or will not be effective for children?
Why or why not?
Oo. While we are waiting daw for the results.
Of the vaccine.
What are your...
Una, we don't even know what kind of vaccine that they're doing for the children. What, no? And even this mRNA, even the ones for adults, they're always countering that, oh, they're not licensed yet for even for anyone, no? For humans, no? But it's always a first time. And the reason why we're having this vaccine so fast is because of the technology. And that's why it hasn't been licensed yet, because it's so new. And we're going to embrace new technology talaga here. Nakita natin ang new technology, nakita natin we can go virtual conventions pala and all that. We can do online. It's a whole new world. It's even when we get back or out of COVID-19, it's going to be a different new world, diba? So even when it comes to the way we see vaccines, it may be different. It's not the usual inactivated or live attenuated vaccines anymore, which took several years to develop. Itong mRNA technology, grabe. Diba, Nida, we were just discussing the quest for the COVID vaccine. Inaanon pa lang ni Frey nung time na yon. And now, we have the vaccines already about to roll out. So, it's hard to speculate about this new technology because you don't know really where it's gonna go next. But hopefully, yun na nga, there's always, ano nga, hope springs eternal nga daw eh. So, we will always be able to find a solution or part of the solution to these things. Of course, syempre tayo, natutunan natin na we only have to cooperate with each other. We only have to be solid and fight this thing together. So
Yeah.
even with children's vaccines, we don't know where we're going, but if it is necessary, then yes, we will have it too for as long as the trials have been done. Thank you.
I think Dr. Mario would like to answer that question also. Dr. Panaligan, Dr. Mario?
No, of course, yun na yung sagot ni
Okay.
Kaya
Okay.
nag-answer live.
Okay. Okay. From Dr. Antonio Palacios. Hi, Dr. Palacios. Oh, I am a post-kidney transplant patient for over a year now. Is it safe for me to have a vaccine even though I'm taking immunosuppressants?
Sige. Good evening, sir. That question was raised earlier. We answered that you can discuss this with your attending physician. PSMID put out the statement regarding immunocompromised hosts, and in that study, we showed a summary of evidence where we stated that the transplant recipient with COVID has a 30% increased risk of death, and the odds ratio is at 1.63. So it's important, if you're actually in healthcare and you're a transplant patient, you can discuss and the receiving the vaccine. And then if you're on immunosuppression, what we usually state is that you have to be guided regarding the efficacy of the vaccine because you're taking immunosuppression. So if, for example, they're stating a 70% efficacy in a general population without comorbidities, you might not have that 70% efficacy. And what value of efficacy for the immunocompromised host, we don't have all those data yet. But because of your risk, it is actually recommended that you receive the vaccine.
Oh, from Dr. Lily Cia Vargas. Ma'am, sabi niya, I am scared of the mRNA vaccine because of the side effects. Ma'am, in question ba yon or you're just stating your fears? Ma'am, wag matakot, wag kakaba-kaba, sabi nga. Okay, from Farah Ginto, if a person has a reaction with the first COVID mRNA vaccine, can that person get a different non-mRNA vaccine? Nasagot na to kanina, right? So if you have a reaction, you don't get the next dose, right?
Yes, definitely you don't get the second dose.
Okay.
But she's asking, can she get a different kind? Well, theoretically she can, but she will have to be evaluated talaga ng mabuti kung ano yung pinag-allergyhan niya. Kasi baka may mga components or adjuvants yung ibang vaccines na doon naman siya din mag-react. So you can't answer that categorically. You have to be evaluated after that.
Okay. From Dr. Raul Limos, what is the target number of people to be vaccinated? 30 to 50% of the population? Yan ang question.
The computation has a mathematical equation actually based on the herd immunity target. So they're saying, for example, the R naught or the transmission rate is at parang at 2.5 or 3. Example lang, if that is the current R naught, it's 2/3. Two-thirds of the population. So if you're at 110 million in the Philippines, that's 0.6667. So that's around 66 to 67 million or 70 million.
Oh, okay.
Big number, right?
Oh, yes, big number. Big number.
But once there is hope, kasi once we get the vaccine going, the reproductive rate, the transmission rate may actually go lower.
Go down.
If you actually go down to 1, then you don't really have to go to that 70 million to get herd immunity.
Yes.
So that's if we start the vaccination early on, we may be able to bring down the R naught and actually you know, we don't have to reach that 70 million kasi parang 70 million, parang 3 taon yata tayo magbabakuna bago natin magawa yun. Di ba? Ano?
Okay. Si Anonymous attendee na naman, dami niyang tanong. Siguro, this is for pregnant.
Is that the same person? Or...
I don't know. Si Anonymous nga siya. Maraming tayong Anonymous ang pangalan. So what are your recommendations for pregnant and breastfeeding women given that vaccine studies are limited and still ongoing? Should they get vaccinated?
The Philippine Society of Obstetrics and Gynecology actually came out with a position statement. Also in their website, it's available. The recommendation is, and WHO recently changed that recommendation kasi dati parang they were very cautious, but now the recommendation is you're pregnant, you're in the healthcare system, you're a healthcare worker, so exposure risk is there. And then if you're past the first trimester, receive the vaccine. Breastfeeding, you can receive the vaccine.
Okay. Thank you.
Again, as long as no history of
allergies. Okay. Oh, Dr. Samuel Irastorza. Question, if ever all the doctors will be vaccinated, especially UERM graduates, pwede na ba tayo mag-gala night sa October? Dr. Mario. Gusto na ni Dr. Sam
Sir, naka-mask, tsaka by batch. So,
magde-decking.
Decking.
Decking. O paano yun? So we will not fill we will not fill up the ballroom of Philippine Plaza, not anymore. Cannot be.
By batch na lang papasok?
Depende kung darating talaga yung mga bakuna. Pero siyempre, kailangan ingat pa rin. Ang nakakatakot siyempre yung binanggit ko kanina, yung variants, no? Kasi may issue pa rin yung effectiveness ng vaccine pagka may variants na iba.
Okay.
That changes the scenario, diba?
That's correct.
Okay. A comment. Excellent webinar covering all aspects from rollout to adverse events about the management, the importance of preventive strategies despite the vaccination. Hearty congrats from President Ruby Pawankar, APAAACI.
A shout out to Professor Ruby. Thank you so much for it.
Thank you, ma'am.
The Asia Pacific Association of Allergy, Asthma, and Immunology.
Oh, okay.
She's
from Dr. Palma Baby. Can I have the COVID vaccine when I develop neurological side effects from a previous hepatitis vaccine? I also developed new angioneurotic edema from insect bite while on steroids from the neuro side effects.
Dami ng problema nangyari kay baby. Guys, ang contraindication lang daw is the reaction, any form of reaction to COVID-19 vaccine. So if you have had any other form of vaccine problem, then you will have to be properly evaluated. And insect bites, you can have naman, kung may mga ibang allergies, yes, you can still receive the vaccine. The risk of not having the vaccine is actually still bigger than, just getting the vaccine na lang talaga. So, best that you have it done.
Okay. Last question. Will this be the last question? From Bernadette Ragolim. There was a case in Texas of an MD who died. The reason they said was probably he has antibodies to COVID-19 virus that made him immunocompromised. If that's the case, is it advisable that we check if we have antibodies to COVID virus first before magpa-vaccinate? Thank you.
The recommendation is not to do those tests. And you have to remember the antibody tests that are available in our country cannot detect the neutralizing antibodies that it's supposed to detect. So sayang lang yung test, basically.
Yes. From, wala ito. Another. Last na ba to? Sige, last na lang to.
Hi pala kay baby Continue doing great paintings.
Yes, baby. Your painting is in my wall and I look at it every day. Thank you for that. One of the fears and expectations is that the Pfizer vaccine for the Philippines will never be enough, even for frontliners, and that the Sinovac vaccine will be the one to fill in the need. And that is what worries me the most.
Not me.
Is that
Disclaimer
what
si President, oh.
Disclaimer.
is that what worries most? Are there worries justified?
Yeah, actually, yun yung mga worries ng iba na partly hindi daw kulang daw talaga ang vaccines, yung Pfizer vaccine, and that the incoming Sinovac vaccines would fill in the void. And yun yung worry ng iba na as to safety, efficacy. So, that's the question from for the speakers.
Yes, sir. I'll try to allay the fear.
Yes.
It's a good thing that the development of the mRNA vaccine came as quickly as it did. The bad thing was, sobrang taas na ng expectation. Kasi nga, umabot sila ng 95%. But you have to see it also in a sense where, what are we trying to prevent here? It's not only the transmission, we're also trying to prevent severity and hospitalization. So if you only look at the efficacy for transmission, hindi talaga tatapat sina Sinovac, sina Astra, sina Janssen. They won't reach that expectation of 95% because of what they see in their trials. But if you look at the part where they studied those who it was able to develop or prevent severe COVID and prevent hospitalization, almost all of those vaccines are at 100%. So yun yung dapat nating tignan. That's why when we kept saying that you're in line, receive whatever vaccine comes, we mean any vaccine that comes.
And
Ang isa pang issue, sorry Bambi, ang isa pang issue lagi, siyempre kaya natatakot, no? Because yung walang data na pinapakita. But don't worry kasi kung wala naman silang EUA, I'm confident that this will not be given to us kung walang EUA. So, for as long as na-evaluate na yan, including the safety, nabigyan ng EUA, and I think it will be safe and therefore we can receive it.
right. No studies have actually, or there's no even application for an EUA according to HTAC. So no application. How will they give naman an EUA? No studies. How will they even recommend it? So no EUA from the FDA. So no EUA. How will it be given by the government? And if they start giving it, I'm already telling you, aalma ang HPAC. That's where we come in.
Yeah. Kasi talaga pwede.
That's all our organizations, our professional organizations. Hindi talaga tayo dapat pumayag na gamitin kahit kanino, kahit sa soldiers pa, na dapat hindi mabigay kung hindi na-approve ng BEP, ng HTAC, ng NITAG, hindi na-recommend na magkaroon ng EUA, ng FDA. So, hindi pwede. Hindi pwede.
Okay. Sorry. Last na lang to.
Kanina ka pa last time.
Hindi last na, kasi interested sila eh.
Kasi may sabi kay Nida na she still looks young. Beautiful.
Hindi, last na to.
Si Anonymous nagsabi. Si Anonymous.
Last na to talaga. Sige, last na to. Ilang taon pa effective ang vaccine? After how many years uulitin ng vaccine? Lifetime na po ba ito? From Eduardo Dolor, I think. Yes. So, hindi anonymous yun na.
There's a parang immunogenicity study that came out recently. They are saying that the efficacy of the vaccine can go until 3 to 6 months. So we might be expecting something like a schedule with similar to the flu vaccine eventually.
Okay, sige.
Last na naman.
Hindi na. Kasi yung tanong na to, kailan ba talaga darating ang vaccine? Sabi nga natin. We will wait. Patience is a virtue.
Correct. Love is patient and kind.
Yes, it's a virtue. I think That's all for now. I don't know if there were questions in
Facebook.
in FB. Maybe we can
Wala
answer
yata.
that. Wala? Oo.
Naman.
Wala nga nag-heart. Mag-heart nga tayo. Heart. Okay.
Ma'am, you have attendees raising their hand.
Ay! Teka, sorry. 3 attendees. Sige, can we allow them from tech? Okay. Miss Christabel C? Ask to unmute. Miss Christabel C? Or napindot lang? Ayan.
You answered my question na kanina. Sorry.
Ay,
Thank you,
okay. Thank you,
Minette.
ma'am.
Okay.
Hi, ma'am.
Thank you.
Okay. From Dr. Niles. Dr. Jen, I will unmute. Dr. Niles, unmute mo yun.
Yeah. Yan, still young and beautiful din.
Dr. Niles. Wala. Ano yun?
Napindot lang yata.
Hindi.
Baka
Andyan
kumakain
siya.
na. Di ba kumakain?
Ha?
Baka kumakain na.
Ay, coffee mate na last na lang. Miss Judeline Vitug. Judeline Vitug. Yes, ma'am. You are kindly unmute.
Sorry, ma'am.
Wala.
Ay, mahina ang volume po. Ang audio.
Nakamute ulit.
Unmute natin siya. Unmute, please. Ayun, wala.
Ay, sorry, ma'am. I did not. Did I raise my hand?
Oo, nakaganon, no?
Sorry po.
Okay, sige.
Thank
you. Dr. Anailes, wala na. Binaba mo na din yung kamay mo. Ayaw mo na magtanong.
Sinabi kasi ni Bossing, young and beautiful din.
Oo, yan. Nahiya tuloy siya. Okay, I think... thank you, doctors, for your expertise from Eugenie, Amanda, Roque. Thank you, too, for joining us tonight. I guess that's the end of our questions coming from our viewers. Any last words from all our panelists, Dr. Mario?
Yeah, first of all, thank you for listening. And of course, we will always emphasize the need for all of us to protect ourselves. No? Kailangan adherent talaga tayo lagi dun sa minimum health standards. So don't be too dependent on the vaccine that's still coming. And we also need to remember, of course, the usefulness, of course, the side effects, the reactions that we will have if in case we receive the vaccine. And wag na tayo mamili. No? Sabi nga ni Dr. Rosario kanina, yung severity ng sakit, yun ang iwasan. No? Importante naman mabigyan, basta tuloy pa rin natin yung mga pag-iingat. Salamat sa kanilang lahat. Over.
Thank you. Dr. Sam, do you have any end notes?
Wala. I think all has been said already, and then probably would like to thank all our speakers for tonight.
Yes.
Yan ang masarap sa alumni association natin eh. We have all the experts, we have all the leaders in the medical field. Whenever we need somebody to talk on a particular medical field, dali lang kumuha. President of this society, past president of this society, member of the technical committee of this on the vaccine. So it just shows the depth and of our alumni. And I would like to thank all the attendees from the Mr. Anonymous na admirer ni Dr. Fontanilla, yes, to all our alumni, and to Vice Chair, Mr. Wilson Yang, who's with us here tonight. Thank you, sir, for attending. So it's been a lively webinar, and I think everybody were able to grasp need for the need and the safety of their vaccines. So I think we had a very good webinar for tonight. Yun lang.
Yes.
Thank pala. So again, kanina nga sinabi ko that this webinar will be on Facebook as well on our YouTube channel. We have our YouTube channel. So please go to that and subscribe, like, and share that channel. And then, of course, our alumni homecoming, our 51st alumni homecoming, we're already starting it with webinars with Class 96. And soon, the celebrating classes will have their own webinars. And yung pabongga series ng ating jubilarians. And hopefully, as I've asked kanina, hopefully we can still have face-to-face annual homecoming on October with the gala night, the alumni awards, and also the convocation ceremonies. So thank you, and good night to everyone.
Thank you to all our panelists. Thank you to all the board members of the College of Medicine Alumni Association. Thank you for our attendees and our tech support, Sanofi. Thank you. So until next time, this is your UERM College of Medicine Alumni Association webinar series signing off. Good night. Bye-bye.
Good night.
Salamat. Bye-bye.
Wait, teka, ano
pa?
Photo muna.
Ay, photo op daw. Documentation talaga naman.
Helen, tsaka Alfred, lumabas kayong dalawa.
Oo, lagi lang silang nakastatwang ganyan.
Oy, nakalimutan ko pala sabihin. Nakalimutan ko sabihin kanina yung yung ating alumni watch. Yung ating alumni watch. No?
Okay. Alumni watch. Can you show? Ayan, Dr. Mark. Lapit mo sa camera. Lapit mo. Yan. Yan naman. Balistad.